I'm Mark Ravi, and I was diagnosed with Crohn's about 10 years ago. Physically, what I was experiencing was some loss of blood. I didn't seek medical attention for that because I just thought it would pass, or it wasn't a huge priority for me. It wasn't painful or anything like exceedingly painful. But when my performance in speed skating started diminishing, then that's when it was affecting me on a daily basis. So that's when I sought medical advice, and different tests started leading down the road of one finding out that I was anemic. So the doctors prescribed iron supplements to try and get my blood levels back to normal. As that didn't work, then different doctors started being involved, and that's later when we found out that there was an IBD issue here.
Gil Kaplan. I'm a gastroenterologist and epidemiologist. My research is funded through Alberta Innovates Health Solution, and I'm on the executive committee of the Alberta IBD Consortium. One of the challenges that we've always have is to try and understand what are the root causes of Crohn's disease and ulcerative colitis. In the more recent last few years, we've discovered over 100 genes that make you susceptible for the disease, but we know that genetics alone doesn't explain the disease, that there are important environmental exposures that interplay with that genetic susceptibility and result in disease development. And with that understanding, we wanted to see what is the burden of inflammatory bowel disease in the world and across time. For two reasons. Number one is we wanted to get a sense of how big of a problem IBD is to Canada, to Alberta, as well as to the rest of the world. And secondly, we wanted to see if there were clues to explain what some of the environmental triggers are of IBD. So we identified in total over 300 manuscripts that have looked at incidence or prevalence of Crohn's disease or ulcerative colitis. We're seeing this in every populated continent across the world. The rates of these diseases are increasing, and they're increasing in relationship to the fact that as countries become industrialized, we're seeing these diseases emerge. That means that with time, many people are probably going to know a friend, a family member who has this disease. And to recognize that this, again, is not a disease that we commonly talk about, because the symptoms that these patients have are things like diarrhea, rectal bleeding. These aren't things that people want to talk about. And so that if you know somebody with Crohn's disease, ulcerative colitis, you just have to recognize that it's a difficult disease, and it's a disease that we should be talking more about, and we should be open with. Because this is a chronic and potentially debilitating disease, and it often affects people who are young at the prime of their lives, when they should be in school or at work, starting their careers, not seeing me in a clinic or in a hospital, not seeing one of my surgical colleagues in an operating theater. And the major implication or impact it has to me personally is just how it affects quality of life, how it affects decisions that they make that are so critical, what careers I'm going to take. And I don't want this disease to control those decisions. I want to be able to use the best therapies that we have in 2011 to heal their bowel, to put them into remission, to keep them into remission, and to make sure that this is just kind of something in the back of their mind rather than something that's actually driving their decisions as they're starting their lives.
I think it's great to be one of his patients, and also just to be in Calgary, since the whole center here is has a large focus on IBD. So even around the world, it's one of the leading places for research and for trying to find a cure for it, or better drugs to treat it. So that gives me hope, and just being one of his patients allows me to ask him what the latest is on the research. And even on research projects that he's not involved with, he still keeps his finger on what's going on in the industry as a whole.